Hi, I'm Dr. William DeMayo from Johnstown, Pennsylvania, and we're going to talk today about sleep hygiene. We're going to cover a lot of material, so I might talk fairly quickly. I am from Johnstown. I'm in private practice, currently working with the John P. Murtha Neuroscience and Pain Institute of Conemaugh Health Systems 1 day a week, and I have a post-polio clinic there and some other clinics that we do. The reason we're going to be talking about sleep apnea is that there's an enormous problem with sleep in the general population, but also specifically in many of the populations that I see in my clinic. The symptoms of sleep deprivation are symptoms that many of us get used to, and we don't really stop and think about the fact that they're connected to our sleep. Things like irritability, stress management, mood swings, cognitive fatigue or decreased concentration. Sometimes we just take these things to be a fact of life, a fact of the stressful jobs that we have, or our stressful kids, or school, or things like that. Physical fatigue, similarly, we just look at our busy life and we say, well, of course we're tired. We get used to these symptoms and sometimes don't stop to think that they are indicative of an underlying problem. Depression and anxiety is interesting because sleep problems can often be a result of depression or anxiety, but they can also be a factor causing depression and anxiety. And you'll see during this talk that there are many issues that become cyclical. And so when as a physiatrist, as a rehabilitation physician, I always look at complex situations where there are multiple factors, and I stop and think not about the things that we can't change, but where can we interrupt this cycle and change something. So for example, when we see a pain and sleep cycle, if we can affect the sleep, that can feed back and help with the pain. Same thing with depression and anxiety. If we can affect the sleep issue through sleep hygiene and affecting our behavior, that can then feed back and actually in some cases folks who are on medications for depression and anxiety can manage them in other ways. Marital, family, and work issues. Again, those issues can cause stress that then cause sleep problems, but the lack of sleep problems leading to mood issues and irritability then feed back and cause some of those relationship problems. Pain I alluded to, and pain is a complex issue obviously, and we can spend the whole time talking about that, but both muscular type of pain and neuropathic pain, both are very, very much affected by our sleep. So for example, muscular pain, a response to lack of sleep is increased muscle tension, especially the neck, but this can be true in the low back, it can be true in the extremities. And so when our pain is coming from those muscles and that's causing lack of sleep, and then the lack of sleep then causes us to get tighter, we get another one of these cycles. Neuropathic pain is a type of pain from nerves themselves. You can get it from nerve injury, diabetes, you can get it from spinal cord problems, anywhere from the brain to the extremities, fingers and toes. If the nerves are affected, you can get this neuropathic pain. Well, that neuropathic pain basically goes through an amplifier, and your nervous system will listen to it or tone it down, and lack of sleep just turns up that amplifier. So even just correcting the sleep issues itself can help substantially in some folks with neuropathic pain. Other medical issues such as high blood pressure, changes in your immune system, weight gain and loss is a big one. There have been some very nice studies linking chronic sleep loss with weight gain. And so by simply changing sleep, one can change their metabolism, but also change their sleep habits. It takes a certain amount of willpower in order to avoid that dessert or to choose something healthier. And when we're not sleeping well, we just don't have the energy, and people will just say, ah, what the heck. And all those what the hecks add up and substantially increase weight, which then feeds back and causes other health issues, obviously. This slide is interesting. This is non-scientific, I want to emphasize that, but it is still informative and just needs to be taken with a grain of salt. But this is a web clipping from MSNBC looking at an online survey of how many hours people sleep. And you can see I circle there almost 80,000 responses. So even though it's not scientific, it's certainly interesting. That's a lot of responses. And only 20% of those who responded said that they got the recommended 8-hour sleep. 75% got substantially less at 5 to 7 hours of sleep, and 6% got 4 hours or less. That is really poor sleep. Now, of course, this is important to keep this in perspective, and this is an online survey, so one would think that the people who are up in the middle of the night who are filling out surveys might be those who aren't sleeping. Well, nonetheless, this certainly shows that there's a lot of people that aren't getting the recommended 8 hours of sleep. This is also a web clipping, and it's nice and colorful. There's a lot of different diagrams out there looking at the stages of sleep, but this is just to demonstrate and reinforce the fact that there are different stages of sleep. Sleep is not an on-off phenomenon. You're not awake or you're asleep. There are different stages of sleep, and without getting into a lot of the sophisticated definitions, it's important to know that in deep sleep, all the muscles relax, and that is where a lot of the healing, that's where a lot of the restorative sleep comes. So it's very important that we look at our sleep hygiene with the goal of trying to increase not just the total amount of our sleep, but the quality of our sleep and being able to get down into a peaceful, deep sleep, because that's where we are going to get our healing. Also, I've underlined that sleep is an active state. People think about sleep as being unconscious. There is thinking that goes on in sleep. There's processing of problems that go on in sleep. We have an awareness in sleep. That's why we don't roll out of bed, because we're aware of the side of where the bed is. So it's very important that people kind of relook at the whole notion of sleep and what sleep is. Insomnia, to talk specifically about some definitions, there are different definitions of insomnia, and quite frankly, none of them are very good. They're not very objective. The American Sleep Disorder Association uses words like complaints of an insufficient amount of sleep. Well, what is sufficient? That's kind of subjective. Of not feeling rested, that's highly subjective. The American Psychiatric Association says that this is difficulty falling asleep, non-restorative sleep, significant distress for at least 1 month. These are all very subjective things, and this needs to be combined with the fact that people oftentimes are not very good at assessing the quality or the quantity of their sleep. If you have individuals who have sleep studies, and you look at the sleep latency, which is the time when the lights go off in the sleep lab, to when their brain goes into a pattern of sleep, when their EEG, their brain waves, it is more frequent than not that the person is way off trying to estimate how long it took them to fall asleep. So the definitions of insomnia are based upon subjective reports, but yet the subjective reports are not always accurate. The other factor is that I alluded to earlier, we get used to some of these symptoms, and so we might not see the effect that they're having. We might not see the distress it's causing in us or our family members until sometimes after the problem is fixed, and then we say, wow, I feel better. For many people who say they don't have a sleep problem, if you ask and say, when was the last time you woke up and said, boy, I feel good. I just had a really good night's sleep. For many people, it's been a very, very long time, but yet the same people will not say that they have a sleep problem. Then when you get their sleep optimized, they can look back and say, wow, I wasn't sleeping very well, now I realize that I am. So according to these definitions, though, about a third of the population has suffered from insomnia in the past year, and 10% have had chronic sleep problems. That's a large number of people. So chronic insomnia can be defined as lasting 6 months or more. Some people would use a 3-month definition. And when you have a chronic insomnia problem, it is clearly more difficult to manage. When we look at the behavioral issues, the training issues, it is more difficult to teach an old dog new tricks. Once we have a certain pattern, it is more difficult. But the key word is difficult. It is not impossible. It simply takes more resolve, and it takes more of an issue of knowing what your goal is and working to achieve it. Some of the common reasons why people sleep, we're going to be focusing on the last, but there's certainly other issues. Pain will affect sleep. Stress and anxiety will affect sleep. Medication, certainly, whether caffeine or alcohol or prescription medications. Environment, light, noise, emotional stress. Lack of exercise, sedentary lifestyle. Urologic issues, older gentlemen with prostate problems that have to get up 3 times to go to the bathroom. That's going to affect their sleep. Urinary tract infections will affect your sleep. All sorts of medical problems can affect sleep. But again, we're focusing here on poor habits and maladaptive behaviors. And these issues feed off one another. And what happens is people oftentimes will be not sleeping because of a medical problem, for example, and then become frustrated and start developing habits that then make their sleep even worse. This shows some overlap in those issues. So we have the sleep behaviors, the sleep hygiene, and that will overlap with people who have sleep disorders. So there's sleep apnea, obstructive sleep apnea, central sleep apnea, something called periodic movement disorder, which is a restless leg syndrome variant. And that's a distinct issue that people will have sleep problems because of that. However, that overlaps, and sometimes you treat that problem, you still have this problem. Similarly, medical problems, whether it be medications that one is taking that is affecting their sleep directly, or the medical problem itself, urologic issues, chronic lung problems, reflux esophagitis, Parkinson's, mood disorders, hypoventilation, so folks with post-polio syndrome or other neurologic issues who don't ventilate well, that's a medical issue in itself which will cause sleep problems, and that overlaps with what we're talking about, which are the habits. So I would encourage folks not to look at one issue, but to look at the totality and see where in that complex can they do something. We're specifically talking about the habits. So how do we change habits? First, we see what we're doing, and sometimes it's not so obvious. We're just used to doing it. Looking at a sleep log can be, for some people, very helpful, keeping track of your bedtime, the time that you fall asleep, which can be difficult to estimate, the number of times that you wake up, whether you document why you woke up, nighttime symptoms such as pain or shortness of breath or anxiety, so they can be unpackaged later on to see whether they can be addressed. And then the time that you wake up versus the time you get out of bed, which might or might not be the same thing. Napping is a common question, and generally napping is not a problem if you are sleeping well at night. But one does need to be careful about napping during the day. If you nap for 2 hours and you're awake 2 hours at night, you're not doing yourself any service. Continuous sleep is far better than fragmented sleep. So sleeping 3 hours, being awake 2 hours, sleeping 3 hours, and then 2 hours in the afternoon adds up to 8, but it is not the same as 8 hours sleep. Another thing to do is, and this is something that's fairly new, are actigraphy bands or applications that are fairly inexpensive now. This used to be very expensive medical hardware, and now for $100 or less you can get a wristband that some of these do a pretty good job. They all have their pros and cons. I'm not going to get into the details of them. I have a little bit of experience with a Fitbit. The Jawbone Up is another one. There's one called WakeMate. And they all have pros and cons. Some of them will actually help wake you at a time close to when you want to get up, but help wake you up during your sleep cycle where you're going to be the most rested. So there's different advantages to each of them, but it can give you a good habit, if nothing else, of how much time you're actually spent sleeping. In the end of the week or the end of the month, you can look and see something in black and white. And when you see it in black and white, now you can set a goal. Okay, I thought I was sleeping enough, but this is how many hours I'm getting. I want to set the goal to set this number. Or I'm not really getting a deep restful sleep because I'm moving around a lot. I want to try and increase my deep sleep. This is one of those cycles I was talking about where pain leads to insomnia, insomnia leads to pain. And it's really important to realize that chronic pain sometimes is impossible to treat unless you address the sleep issue. I use the analogy of it's like putting out a fire and the firemen come and there's gasoline pouring on the fire or some type of fuel. Before they take out the fire extinguisher or their fire hose, they're going to turn off the fuel. And that's what insomnia is to sleep. Insomnia is to pain. The pain is the fire, and you want the fire to go out. That's your goal. But sometimes you have to work upstream and address the sleep issue. That's the gasoline making it work. You shut that off, and now the pain issue becomes manageable. So for folks who have chronic pain issues, that's a very important point. So sleep is a trained behavior. I use the analogy that it's like training a dog, and sometimes people have a very passive approach to sleep. That oh, you know, it's just me, and this is how many hours I sleep, and you know, I couldn't sleep anymore, or I've always slept this way. And I just don't buy that. Sleep is a trained behavior, and we can train ourselves to sleep less, we can train ourselves to sleep more. So as an example, when we're training a dog, it's very important to be consistent. You don't give up when the dog pees on the carpet once or twice or even the third time. You stay at it, and that's the way it's important to be with sleep. Consistency is really key. Having a pre-training routine. If you're going to train a dog and do a good job, the dog needs to know when it's going to be trained. You do it at the same time of day. You go through a cycle of a process so that the dog knows that you're taking him to a specific place and we're doing our training, and he'll look up and he'll be ready to be trained. You don't train him whenever you want or just a little bit here and there. If you really want to do a good job, you do it consistently, same time of day, you do the same thing, and you have a pre-training routine so he knows. If you ask most people, how does your body know that it's time to sleep? They say, well, when I get tired. Well, that's like the dog saying that it knows it needs to go to the bathroom. It's going to go to the bathroom when it wants to go to the bathroom. That's not the point. We want to train the dog when it sits, when it's going to go to the bathroom, when it's going to go out. And so you want to control the sleep issue. You're going to need to work on these training maneuvers. You also have to be careful about untraining, so that, for example, if you are lying in bed awake, your pillow can become associated with being awake. And so that would be analogous to a dog that's well trained to sit. You say sit, the dog sits. You say sit, the dog sits. But if you use that command going on a walk, and you walk for 2 hours, and hundreds of times you give the command to sit, and you do that for 2 hours a day for a week, you won't be surprised on the weekend if the dog comes to the room and you say sit, and he doesn't sit. He might go to the front door. Now it's associated with walking, not with sitting. Same thing, if you're laying in bed on your pillow, which should be the command to sleep, you lay in your head on the pillow, you're going to fall asleep, but you're wide awake. If you do that for too long, you're now associating the command with a different response. So you need to be sensitive to that. And you also want to be careful about positive reinforcement of the undesired behavior. If the dog pees on the carpet, you don't want to say, poor doggy, and give him a doggy treat. That would be ridiculous. You're reinforcing that he's going to do it again. But yet people wake up in the middle of the night and they want to feel better, so they read, they turn on the TV, they eat. All of those are positive reinforcements for exactly the opposite behavior that you want. So look very carefully how your behaviors are affecting your sleep, both positively and negatively. Also keeping track that we're all human, and so we're going to develop these dysfunctional behaviors, and we might fix them, and then after a while we kind of gravitate back to doing it. And so there's definitely a role for retraining and looking at this on an ongoing basis. Some things that can be helpful: cognitive behavioral therapy with a psychologist or another healthcare provider who is trained, things like progressive muscle relaxation, guided imagery, biofeedback, stimulus control. Hypnotherapy in some people can be helpful. And there's other techniques that can be done with a professional. There's also things that you can do on your own. So there are relaxation tapes or downloadable relaxation audio programs, audio Bibles. There are sound apps for relaxing sounds, whether it be waterfalls or rain. Of course, things like that can be a problem with individuals who have prostate problems, for example. So you need to be careful about how you pick these, but there's a lot out there, and you want to try and find something that's going to help you to get to a peaceful, relaxing place. Some of the things that you don't want to do. Alcohol, people think about alcohol as helping sleep. It does not. Alcohol will help you fall asleep, but it impairs the quality of your sleep. So be very careful about seeing that as an issue on an ongoing basis. Caffeine, people think about drinking caffeine just before bed. If you have a sleep problem, you want to be careful about caffeine use in general, not just prior to bed. Nicotine as well can affect your sleep. Daytime napping, I think I mentioned, and it's no problem with daytime napping if you are sleeping well, but presumably if you're listening to this lecture, you're not, and so daytime napping is something to avoid. Rest is fine, so taking a break, doing some peaceful relaxation during the day, taking a little vacation to relax your mind and your body, great, but try not to fall asleep, because that will rob your drive to get into deep sleep at nighttime. And exercise is really key. Lack of exercise during the day is an issue. Now, some people say too much exercise at night can be a problem, but newer studies are showing that that's not the case. So you simply want to see how your body reacts, but in terms of doing exercise just before going to bed, that's a little bit of a controversial issue at this point. Some other don'ts. Look at your sleep environment. Don't be trying to sleep with a noisy environment with distractions and other stressors going on. The temperature of the room, your positioning, things like body pillows can be very helpful. You can wear earplugs, masks, thick drapes. Just look at all the things in your environment that you might be able to change to maximize the possibility you're sleeping well. Medications are a big issue. So I would suggest taking a list of your prescription medications and your over-the-counter and your herbs and complementary medicines, bring them to the pharmacist and have them run. Now, just because it's associated with a sleep problem does not mean it's causing a sleep issue. You just highlight that, bring it to your healthcare provider, and take a look at that as to whether or not that might be something to change. The other thing to keep in mind is that most prescription sleep medications are not approved for long-term use. Very frequently they're used for long-term use, but if you read it, the problem is that they deprive you of deep sleep. Like alcohol, they put you to sleep, but they deprive you of the deep sleep, so not a really good idea on a long-term basis. Television, TV, computer reading, those are all things that help people who might be stressed to get unstuck from the thoughts that they're having from the day, but basically what they're doing is they're substituting one stressful issue for something that's also stimulating. Far better if you use that, maybe you watch TV for a while, but still before getting in bed, you do something that is clearly more peaceful and relaxing and doesn't have that stimulation associated with it. Pets are wonderful. Pets can be very helpful from the standpoint of relaxation in your pre-bedtime routine. Just sitting down, petting your pet, being relaxing with the pet. Sleeping with your pet is a different story. And so I'd be very careful about looking at the effect of your pet on your sleep. Nobody wants to roll over on Fido, okay? So, and so you have to be aware of Fido is, and which means that you are not going to settle down into as deep a sleep. It's like sleeping with an infant. You simply don't get as deep a sleep when you have an animal in your bed with you. Some of the do lists. You want to have a very specific bedtime, very specific wake time, and stick to it. Now, if somebody's not having a sleep problem, then some variation in that is that is what it is. But if you are having a sleep problem, you want to be as strict with that as possible. Again, having a bedtime routine, it's called sleep priming. Basically getting your mind to a peaceful place in whatever floats your boat. Spiritual activities are great for this time. It doesn't have to be. It could be any relaxation app or music or whatever, but nothing with a lot of stimulation. The antithesis of this would be watching the news. Rape, murder, violence, tsunamis, hurricanes. This is all negative stuff. We want peaceful things before we go to bed. Consider adapting your environment. We talked about that, especially body pillow I mentioned because of some of the musculoskeletal problems, sacroiliac back pain, things like that. I talked some about sound machines. This is a key issue. If you're unable to sleep for 15 minutes, the books sometimes say 10, but even up to 30, but definitely don't be laying there for hours. It's important to get up and leave the bed. Again, because you don't want that pillow associated with being awake. You want it associated with sleeping. So better to get up, sit in a chair, do something that's monotonous but peaceful. No TV, no reading, no stimulating activities. And eventually, if you give yourself two choices, sleep or be bored, eventually you'll pick the sleep. Sleep affects the whole person and the whole person affects sleep. So I really suggest that people look at this not just, oh, my pain causes me to have a sleep problem. We want to look at the emotional, psychological factors and the spiritual factors. I've yet to see an atheist in my office. I see a lot of people who are agnostic. They don't know what they believe. I see lots of people who had issues with a certain religious factor that happened in their life. But most people have a sense that there's a God there and that they have some peaceful thoughts associated with that. So it's best to jettison all of the stressful things that one might have associated in their life, but focus with regard to spirituality on something that brings peace, and that works itself very well into the pre-bedtime routine. A couple of very quick examples to illustrate these points. Job stress would be an issue that many people have. And oftentimes that people say, my job is so frustrating. And I had a woman who came to my office and she was sleeping 3 hours a night And she was a wonderful woman, but she worked for a nurse line where they called in. And so I asked her, well, why aren't you sleeping? She said, well, every day people yell at me. And she loved her job, but she had a lot of frustration with regard to these phone calls. And so I listened to her, and she was a very sweet woman, but I said, you can't expect that people are going to be nice to you just because you're nice to them. And she said, I don't expect that. And I said, yes, you do, because otherwise you wouldn't be frustrated when it doesn't happen. So the point here is that if this woman changed her expectations and she expected to have 4 or 5 people yell at her every day, then when only 2 or 3 did, she had a great day, no frustration. So that's Dr. DeMayo's surefire way of eliminating every ounce of stress in your life. If you change your expectations, the frustration goes away. So if you're feeling frustrated, think about the expectation. Sometimes the expectation is, I'm going to make my boss happy. That might not be a possibility. Your boss might be going through divorce. He just might be a mean person, and he's just never going to be happy. Nobody's going to make him happy. So think about what your expectation is that's leading to the frustration, and that can go a long way to addressing your sleep issues. Lastly, an example again with spirituality. I had a young man come to my office who was sleeping for only 2 hours per night. And I said, I'm not going to get rid of your neck pain until we get to the bottom of the issue with your sleep. Why aren't you sleeping? He said, I'm going through a divorce, custody battle for 4 kids. I lost my job, and I got an eviction notice for my house. Now, most people will say, well, that explains that. But it doesn't need to. And so as I commonly do, I asked this gentleman about his spiritual life. He said, I have none. And again, I haven't met atheists in my office. So I said, well, do you believe in God? And he said, well, sure I do, but I'm not Christian or anything. I go to a church. I said, I didn't ask that. That's religion. He said, tell me about what you believe in God. He said, well, I live in the woods, and every day I go for a walk in the woods, and I feel God's there, and so I talk to him. I said, so you talk to God every day? He said, yeah, I do. And I said, well, I have news for you. You have more of a spiritual life than a lot of people who actually go to church every Sunday, and they're dragged there, and it's really not a spiritual activity. It's a social activity for them. So tap into that spirituality. And here my suggestion for him was this, that he sits out on his porch, looks at the stars, listens to the crickets, talk to God for 15 minutes just before getting into bed. So we need to contrast someone who talked for 15 minutes with God on his terms, whatever floated his boat, whatever he feels is peaceful, versus somebody laying in their bed thinking about divorce, custody battle, losing their job, losing their house. He comes back and he's sleeping 5 hours a night. Look like a new man. Still not a lot of sleep, but now I had something to work with. So the key here is that we're not looking for a new understanding. We're looking to simply look at things that we already believe spiritually, but use them in order to come to a place of peacefulness. That's sleep hygiene. I hope that that's been helpful. I hope that that has stimulated some thinking, and that you can move forward. Look at your sleep behaviors. Look at where along this problem you can intervene and take some action. Thanks for being with us.